welcome to section 6 of cardiovascular anatomy. In this section, we will discuss the gastrointestinal veins and the portal system. This table breaks down the veins of the GI system in a very simple way. We have the inferior mesenteric vein, the splenic vein, and the portal vein. This image depicts the GI venous system and can be found in section 6 of your text in the cardiovascular anatomy chapter. We will go into the details of this image and emphasize the information from the table I just showed you. Right now, I will just give you a brief overview so you have a roadmap. Right here is the inferior mesenteric vein, and this drains the hindgut, or the distal 1/3 of the transverse colon, so about right here, and down all the way to the pectinate line. The inferior mesenteric vein then drains into the splenic vein. We can see the splenic vein labeled right here, and the IMV drains into this. The splenic vein then joins the superior mesenteric vein, and this drains the midgut structures. So these combine, and now we have the portal vein. The portal vein then goes up to the liver where the blood can be filtered. Now notice this left gastric vein right here. This drains the lesser curvature of the stomach, and then it drains into the portal vein. So in this way, deoxygenated blood from the lesser curvature of the stomach can go through the portal vein. With that overview, let's get to the details to help you dominate your board exams. And first we'll focus on the IMV, and starting with the superior rectal vein. The superior rectal vein drains blood from the portion of the rectum above the dentate or pectinate line. Recall from the previous lecture that the inferior rectal veins will drain the rectum distal to the dentate or pectinate line. These then ultimately drain into the internal pudendal, internal iliac, and into the IVC. In other words, blood draining into the inferior rectal veins down here will actually bypass the liver and the portal system because they're going straight to the heart this way. And this image again depicts the inferior rectal veins. However, the superior rectal veins travel through the portal network. And as mentioned in the previous lecture, liver cirrhosis will lead to high pressure in the portal network, which actually exerts its effect at the superior rectal veins, creating these anal rectal varices. Now let's talk about the splenic vein. When discussing the splenic artery, we stated how the gastric fundus is entirely dependent on the splenic artery. Now a similar principle can be found with the splenic vein, because it drains the gastric fundus. And it does this through these short gastric veins. And this makes sense. If the short gastric arteries supplied the gastric fundus, then the short gastric veins would take the blood from the gastric fundus. And of course, the splenic vein drains the spleen as well. Now, an important clinical tie-in is that if there is thrombosis in the splenic vein, this will increase the venous pressure, which will lead to varices in the gastric fundus. To illustrate this visually, let's look at how compression of the splenic vein can cause congestion of blood in the short gastric veins. So let's say there's compression right here. This would lead to high pressure throughout the short gastric veins, which will ultimately lead to varices right here. And once again, the compression can be caused by thromboses and, of course, portal hypertension. Now, the reason these fundus varices are important is because they can present similarly to esophageal varices. So if a patient has portal hypertension and hematemesis, they are likely to have esophageal varices, but they could have varices of the gastric fundus. This means that esophageal varices and varices of the gastric fundus can be distractors for one another on a test, so watch out. Now let's dive more into the portal vein. The portal vein drains the superior mesenteric vein, the inferior mesenteric vein, and the splenic vein, and then it empties into the liver. In this way, the portal vein allows for filtering of blood from the digestive tract. Now, in the case of liver cirrhosis, the portal system will increase in pressure, and this will lead to increased pressure in the veins that drain the portal system, which ultimately leads to varices. These varices can occur because of increased pressure in the splenic vein, which causes varices in the gastric fundus, which we just discussed, or increased pressure in the left gastric vein, which causes esophageal varices, or the superior rectal vein, which causes anal rectal varices, or the paraumbilical vein, which causes caput medusae, which is another name for umbilical varices. To illustrate this visually, see that the left gastric vein drains into the portal vein. And notice that it actually supplied this distalmost area of the esophagus. Therefore, with increased pressure in the portal system, there will be increased pressure in the left gastric vein, leading to these esophageal varices. Now, the left gastric vein forms these varices with the esophageal vein, which actually drains into the azygous vein, which then drains into the IVC. Now, this connection is very important in high yield, because this is where esophageal varices come from in portal hypertension. So again, the esophageal vein and the left gastric vein. Now let's move down to the next important portal venous anastomosis. It involves the paraumbilical vein, as well as the superficial epigastric vein right here. When pressure from the portal system comes down like this, it can form varices, which we can call caput medusae because it ends up looking like Medusa's head, or we can call these umbilical varices. In a previous lecture, we discussed how increased portal pressure can increase pressure in the superior rectal vein, which can lead to anal rectal varices with the inferior rectal veins. So we won't go into any more of that right now. So now we've discussed all the information in this table. We've discussed all these varices, the portal vein, splenic vein, and the IMV, and how they're relevant and how you can be tested. Now let's do a question to solidify what you've learned. A 55-year-old female with known liver cirrhosis presents with massive hematemesis. Evaluation confirms the presence of ruptured varices. What vein of the portal system is directly involved in the varices? Does it drain into the splenic vein, the portal vein, or the superior mesenteric vein? Now recall that the left gastric vein forms an anastomosis with the esophageal vein. The esophageal vein drains into the azygous vein, which drains into the IVC, whereas the left gastric vein drains into the portal vein. So the first question asks what vein of the portal system is directly involved in these varices? That would be the left gastric vein. Does it drain into the splenic vein, the portal vein, or the superior mesenteric vein? It drains into the portal vein. Notice how the inferior mesenteric vein drains into the splenic vein right here, and this forms the portal vein. So by the time the left gastric vein drains into the portal network, it drains into the portal vein. So again, the hematemesis in this cirrhotic patient resulted from increased portal pressure leading to ruptured esophageal varices, which gives them hematemesis. So the answer to our question is the left gastric vein, which drains into the portal vein. And that concludes this section.